A nutrition assessment chart evaluates a patient's nutritional status, enabling personalized care, monitoring progress, preventing complications, and improving communication, ultimately enhancing patient outcomes. To record nutrition assessment, follow these steps. Navigate to the clinical module and select the Inpatient Panel. As shown, in the new window that opens, a list of admitted patients will be displayed. Select the patient you wish to attend to. If the list is extensive, you can use the search bar to easily find and select the patient, and click on the Actions button and select Inpatient Charts. From the menu list, choose Nutrition Assessment. In the next window, fill in the required fields. Input the date of the nutrition assessment for accurate tracking. Record the principal diagnosis to inform dietary recommendations, and list biochemical data and medical tests to evaluate the patient's health status. Next, measure and record the patient's height for calculating BMI and other assessments. Weigh the patient and document their weight to assess nutritional status, and measure MUAC to evaluate muscle mass and overall nutritional health. Calculate and record the Z-score for growth assessment in children, as well as the BMI to classify weight status. Assess the BMI in relation to age to evaluate growth patterns, and note any other relevant measurements or observations. Document findings from the physical exam and clinical assessment, and record the patient's food and nutrition history to identify dietary patterns. Additionally, document any medications that may affect nutritional status, and note any surgical procedures that impact nutritional needs. Create a PES statement to summarize the nutrition diagnosis and outline the nutrition prescription tailored to the patient's needs, specifying carbohydrate intake as part of the plan. Outline protein intake to support health and recovery, and document recommended fat intake to ensure balanced nutrition. Calculate the total caloric intake required for the patient's needs, list other nutrition interventions planned, and document any additional necessary interventions for comprehensive care. Specify the route of administration for nutrition support and record the name of the nutritionist responsible for the assessment. Then click on the plus button to save. To chart items, select the nutrition assessment chart from the view window. Next, click on the Nutrition Care Processes button. In the subsequent window, fill in the required details, including the exact timestamp of when the assessment was completed for accurate tracking. Document the name of the nutrition officer responsible for the assessment, and include any relevant notes from the nutrition review to highlight key observations and recommendations. Sign off with the name of the person who completed the assessment for accountability, then click on the plus button to save. To view the nutrition assessment chart report, close the window. In the subsequent window, click on Generate Report, where you can share the report via email, download it in various formats, or print directly from your browser.